My name is Benjamin Frye. I'm an orthopedic surgeon at WVU Medicine, and I specialize in hip and knee replacement surgery. It's nice taking care of West Virginians because I am a West Virginian, so I feel like I have a lot more connection than, say, if I practiced in another state. And I enjoy getting to get people, back to work and enjoyment and everything that they love about West Virginia. What I like most about orthopedic surgery is not only the surgeries themselves, they're fun to perform. I get to use a lot of equipment and technology, which is fun to use. But the best thing by far is seeing how we can impact people's lives and take someone out of pain, and that just immediate gratification of knowing that I helped someone and really changed their life. It takes a whole team to do a good job with joint replacement. So really my superpower, I would say, is my team that helps me with this, all the way from getting patients ready for surgery, getting patients scheduled, helping me in the operating room, helping take care of them in the hospital and in the clinic afterwards. So I have to really give a lot of credit to my team as well. I think WVU Medicine is definitely the best care you can get in the region. We also take care of a lot of complex surgeries where maybe patients have had their joints done elsewhere and they either have infections or fractures or dislocations of their hips, and then we have to redo those surgeries to help with those complications. The research is very important. We always need to be getting better. My team and I like to stay up to date on the newest techniques, the newest technologies, and we really don't want to get complacent and just do things the same way because we've always done them that way, because things are constantly evolving. So I really enjoy being at the forefront of that, tracking patient outcomes and pain scores and function scores so that we really know if we're doing the best job. I'm a family person. I really like spending time with my family, and my young kids are involved in sports and theater and band, and I really enjoy watching them grow and have fun with their activities. I do enjoy skiing in the winter. We're a skiing family for sure, so we try to get to the slopes as much as we can in the winter. Probably the most important thing I want patients to know about me is that I work hard for them. I make sure that they're going to be the best candidate for surgery. I make sure that I do the best job that I can, providing them the best possible joint replacement that they can receive. And then I surround myself with a lot of people that help make sure they're ready for surgery and help me take care of them afterwards so they have the best possible outcome.